Heart disease prediction using machine learning. Techniques. Abstract heart diseases, also known as cardiovascular diseases, encompass a wide range of conditions that affect the heart. These vary from blood vessel diseases, heart rhythm problems to heart defects that one is born with. It is the primary cause for death worldwide over the past few decades. It is the need of the hour to obtain accurate and reliable approach to achieve early diagnosis of the disease by automating the task and hence realize efficient management of it. Data science plays an important in processing large amounts of data in the field of medical sciences. Researchers utilize several data mining and machine learning techniques to analyze large sets of data and aid in the right prediction of heart diseases. This paper analyzes the supervised learning models of logistic regression, naive Bayes, support vector machine, k-nearest neighbors, decision tree, random forest, and the ensemble technique of XGBoost to present a comparative study for the most efficient algorithm. It is found that random forest provides most accuracy with 86.89% in comparison to other algorithms. Keywords: logistic regression, naive Bayes, support vector machine, k-nearest neighbor, decision tree, random forest, XGBoost, heart disease prediction. Introduction. Cardiovascular diseases are the primary cause of death worldwide over the past decade. According to the World Health Organization, it is estimated that over 17.9 million deaths occur each year because of cardiovascular diseases, and out of these deaths 80% is attributed to coronary artery disease and cerebral stroke. 1. Many habitual factors such as personal and professional habits and genetic predisposition accounts for heart disease. Various risk factors such as smoking, overuse of alcohol and caffeine, stress, and physical inactivity, along with other physiological factors like obesity, hypertension, high blood cholesterol, and pre-existing heart conditions are often deciding factors for heart disease. The efficient, accurate, and early medical diagnosis of heart disease plays a pivotal role in taking preventive measures to avoid the complications that arise due to such diseases. The major challenge faced in the world of medical sciences today is the provision of quality service and efficient and accurate prediction. The latter problem can be solved by automation with the help of data mining and machine learning. Data mining is defined as a process used to extract usable data from a large set of raw data. It implies analyzing patterns in large batches of data by making use of various software. It also involves effective data collection and warehousing coupled with computer processing. Machine learning, ML, which is subfield of data mining that deals with large-scale well-formatted dataset efficiently. In the medical field, machine learning can be used for diagnosis, detection, and prediction of various diseases. Various machine learning algorithms such as logistic regression, naive Bayes, support vector machine, k-nearest neighbor, decision tree, random forest, and the ensemble technique of XGBoost are compared to find the most accurate model. Here the heart disease dataset from the UCI repository is used. In this research, a discussion and comparison of the existing classification techniques is made. The paper also mentions scope of future research and different advancement possibilities. 2. Related work. GOMPETAL used naive Bayes and decision tree data mining techniques for predicting different types of diseases. They mainly concentrated on prediction of heart diseases, diabetics, and breast cancer. The results were derived from the confusion metrics. Miranda et al. Proposed naive Bayes classifier approach for the prediction of the cardiovascular diseases. The authors have considered few important risk factors for deciding the heart disease. Avinash Goland and et al. Studies various different ML algorithms that can be used for classification of heart disease. Research was carried out to study decision tree, KNN, and k-means algorithms that can be used for classification, and their accuracy were compared. This research concludes that accuracy obtained by decision tree was highest. Further, it was inferred that it can be made efficient by combination of different techniques and parameter tuning. Fad Saleh Alatabi has designed a ML model comparing 5 different algorithms. Rapid Miner tool was used, which resulted in higher accuracy compared to MATLAB and Weka tool. In this research, the accuracy of decision tree, logistic regression, random forest, naive Bayes, and SVM classification algorithms were compared. Decision tree algorithm had the highest accuracy. Teresa Princi et al. Executed a survey including different classification algorithm used for predicting heart disease. The classification techniques used were naive Bayes, KNN, k-nearest neighbor, decision tree, neural network, and accuracy of the classifiers was analyzed for different number of attributes. 3. Data resource. The Cleveland Heart dataset from the UCI machine learning repository has been used for the experiments. The dataset consists of 14 attributes and 303 instances. There are 8 categorical attributes and 6 numeric attributes. The description of the dataset is shown in the table. Attribute description range. Age of person in years 29 to 79. Sex gender of person, 1M0F, 0,1. CP chest pain type 1, 2, 3, 4. Tresps resting blood pressure in mmHg 94 to 200. Cole serum cholesterol in mg/dl 126 to 564. FBS fasting blood sugar in mg/dl 0,1. Restec resting electrocardiographic results 0,1, 2. Thalage maximum heart rate achieved 71 to 202. Exang exercise induced angina 0,1. Old peak ST depression induced by exercise relative to rest 1 to 3. Slope of the peak exercise ST segment 1, 2, 3. CA number of major vessels colored by fluoroscopy 0 to 3. Thal 3, normal, 6, fixed defect, 7, reversible defect 3, 6, 7. Result class attribute 0, 1. Patients from age 29 to 79 have been selected in this data set. Male patients are denoted by a gender value 1 and female patients are denoted by gender value 0. 4 types of chest pain can be considered as indicative of heart disease. Type 1 angina is caused by reduced blood flow to the heart muscles because of narrowed coronary arteries. Type 1 angina is a chest pain that occurs during mental or emotional stress. Non-angina chest pain may be caused due to various reasons and may not often be due to actual heart disease. The 4th type, asymptomatic, may not be a symptom of heart disease. The next attribute Tresps is the reading of the resting blood pressure. Cole is the cholesterol level. FBS is the fasting blood sugar level. The value is assigned as 1 if the fasting blood sugar is below 120 mg/dl and 0 if it is above. Restec is the resting electrocardiographic result. Thalage is the maximum heart rate. Exang is the exercise-induced angina which is recorded as 1 if there is pain and 0 if there is no pain. Old peak is the ST depression induced by exercise. Slope is the slope of the peak exercise ST segment. CA is the number of major vessels colored by fluoroscopy. Thal is the duration of the exercise test in minutes, and number is the class attribute. The class attribute has a value of 0 for normal and 1 for patients diagnosed with heart disease. 4 Approach methodology. A. Classification algorithms. Classification is a supervised learning procedure that is used for predicting the outcome from existing data. This paper proposes an approach for the diagnosis of heart disease using classification algorithms. The dataset has been divided into a training set and a test set in ratio of 80 and 20, and individual classifiers are trained using the training dataset. The efficiency of the classifiers is tested with the test dataset. The working of the individual classifiers is explained in the preceding section. 1. Logistic regression. Logistic regression is a supervised learning classification algorithm used to predict the probability of a target variable. The nature of target or dependent variable is dichotomous, which means there would be only 2 possible classes, 0 for failure and 1 for success. 2. Naive Bayes classifier is a supervised algorithm. It is a simple classification technique using Bayes' theorem. It assumes independence among attributes. Bayes' theorem is a mathematical concept that is used to obtain the probability. The predictors are neither related to each other nor have correlation to one another. All the attributes independently contribute to the probability to maximize it. Many complex real-world situations use naive Bayes classifiers. 3. Support vector machine. An SVM model is basically a representation of different classes in a hyperplane in multidimensional space. The hyperplane will be generated in an iterative manner by SVM so that the error can be minimized. The goal of SVM is to divide the datasets into classes to find a maximum marginal hyperplane, MMH. 4. K-nearest neighbor. The K-nearest neighbor algorithm is a supervised classification algorithm method. It classifies objects dependent on nearest neighbor. It is a type of instance-based learning. The calculation of distance of an attribute from its neighbors is measured using Euclidean distance. It uses a group of named points and uses them on how to mark another point. The data are clustered based on similarity amongst them. KNN algorithm is simple to carry out without creating a model or making other assumptions. This algorithm is versatile and is used for classification, regression, and search. Even though KNN is the simplest algorithm, noisy and irrelevant features affect its accuracy. 5. Decision tree. Decision tree is a classification algorithm that works on categorical as well as numerical data. Decision tree is used for creating tree-like structures. It is easy to implement and analyze the data in tree-shaped graph. This algorithm splits the data into two or more analogous sets based on the most important indicators. The entropy of each attribute is calculated and then the data are divided, with predictors having maximum information gain or minimum entropy. The results obtained are easier to read and interpret. This algorithm has higher accuracy in comparison to other algorithms as it analyzes the dataset in the tree-like graph. However, the data may be overclassified and only one attribute is tested at a time. For decision making. 6. Random forest. Random forest algorithm is a supervised classification algorithmic technique. In this algorithm, several trees create a forest. Each individual tree in random forest lets out a class expectation and the class with most votes turns into a model's forecast. In the random forest classifier, the more the number of trees, higher is the accuracy. It is used for classification as well as regression task, but can do well with classification task, and can overcome missing values. Besides, being slow to obtain predictions as it requires large data sets and more trees, results are unaccountable. 7. XGBoost. XGBoost is an optimized distributed gradient model designed to be highly efficient, flexible, and portable. It is a decision tree-based ensemble machine learning algorithm that uses gradient boosting framework. It provides an optimized gradient boosting algorithm through parallel processing, tree pruning, handling missing values and regularization to avoid overfitting or bias. Result and analysis. The aim of this research is to analyze the performance of various classification algorithms and in doing so find the most accurate algorithm for predicting whether a patient would develop an heart disease or not. This research was done using techniques of logistic regression, naive Bayes, support vector machine, k-nearest neighbor, decision tree, random forest, XGBoost on the UCI dataset. Dataset was split into training and test data and models were trained and the accuracy was noted using Python. A comparison of the performance of the algorithms are depicted below and their accuracy scores are presented in the table. 6. Conclusion. The overall aim is to define various data mining techniques useful in effective heart disease prediction. Efficient and accurate prediction with a lesser number of attributes and tests is the goal of this research. The data were pre-processed and then used in the model. Random forest with 86.89% and XGBoost with 78.69% are the most efficient algorithms. However, k-nearest neighbor performed with the worst accuracy with 57.83%. We can further expand this research incorporating other data mining techniques such as time series, clustering and association rules and other ensemble techniques. Considering the limitations of this study, there is a need to implement more complex and combination of models to get higher accuracy for early prediction of heart disease.